with high risk self-harm and suicide, crisis line experiences, and online potentials. So we'd like to first begin by introducing ourselves. Hello, everybody. My name is Raha Masoudi. I use she, her pronouns. I'm an undergrad student at UBC pursuing a bachelor's in science. I'm a volunteer with the Addictions and Concurrent Disorders Research Group. And my future goals include working within the healthcare and mental health fields.
And my name is Gurpreet Chopra. My pronouns are he and him. I have a degree in biochemistry and I'm currently a UBC student researcher. I'm also actively involved in substance use and mental health research here at the ACD group at UBC, just like Raha.
We would first like to start by acknowledging that we are gathered here today virtually on the traditional, ancestral, and unceded territory of the Musqueam, Tsleil-Waututh, and Squamish and Swasin people, on which we currently reside and work on. We express our gratitude to them, and we value the opportunity to learn, live, and share educational experiences on this traditional territory. So with that being said, here is an overview of what we will cover today, and a focus will be put on our experiences as volunteers and workers as crisis line responders. So our work here will be not be based on formal research, but rather it'll be largely anecdotal, and we hope that you guys find this experience enriching and hopefully learn something new. So we're going to go through who we are, what is crisis work, our experiences with people who use substances, the issues we see in different areas of crisis work, and online potentials for crisis intervention and care. We'll also give time for questions between each section and at the end. So we'd like to introduce what we do. So I'm a crisis responder with Kids Help Phone. I've been doing that for about 1.5 years. And Kids Help Phone provides support for youth and adults through an online texting platform. It also has a calling platform and an online chat, but I work with a texting platform. I'm also a peer supporter with AMS Peer Support, which is a service that provides free, confidential, one-on-one peer support for students and staff on UBC campus.
And I have been a crisis services responder for Crisis Center BC for about 2 to 3 years now, bordering on 3 at this point. And I provide support to callers on 1-800-SUICIDE, 310 mental health, different mental health support lines, crisis center chat.ca, youthinbc.com. And I also train new volunteers here at the center where I help them become the crisis service responders.
Awesome. So before we dive into our presentation, we'd like to begin with a sort of interactive discussion question. And we'd like to ask you, why would someone use crisis services? Feel free to unmute your mic, add comments in the chat. You can pose comments in the Whova chat as well. Feel free to chime in.
I guess I'll start with the obvious answer, which would be for myself when in crisis or I have an issue. It seems quite overwhelming until sometimes it's just I can't think of a solution, and it's nice to just bounce it off someone, right?
Mm-hmm.
Absolutely. Mm-hmm.
The other bonus is because it's over the phone, I don't feel judged. There's no face, and I don't have to worry about actually hopefully never meeting the person. No offense, everyone. Yeah.
None taken. Thank you so much, Tom. Thank you.
Fair enough, yeah.
And also in the chat, we have people adding some really insightful comments, mentioning things like isolation, suicidal thoughts, accessing services after hour, having no one, feeling safe with a stranger, feeling overwhelmed, thoughts of self-harm and no support to turn to, trauma. These are all such good and very real situations where people might turn to crisis services for support. Absolutely. Mm-hmm. So yeah, I mean, all those answers were spot on. Those are definitely some of the topics that come up. And one thing that we really want to iterate is that crisis does not mean the same thing for everyone. It could be like the loss of a loved one, suicidal ideation, thoughts of self-harm, but it can really mean anything. During my training with Kids Help Phone, they mentioned that the day that Zayn Malik left the band One Direction was actually one of the busiest days that the hotline had. So this goes to show that crisis is different for everyone, and it really is on the spectrum. On this slide, I just wanted to present and contextualize the group that I work with. I work primarily with youth mental health at Kids Help Phone, and I'd like to make a note of a reality that is sometimes often overlooked. And in their latest campaign, Kids Help Phone highlighted that adults may not see what young people are truly struggling with and may not take their problems as seriously as their own. But the reality is that kids have adult-sized problems. Anxiety, depression, grief are big issues that need to be heard. So yeah, these topics here are some of the issues that I've written out that are most commonly addressed in conversations with kids, and they do not discriminate against age and are faced by both adults and kids the same.
Yeah, and before we dive into crisis work, we wanted to give you an overview of what crisis work is, and give you guys our special secrets and our special sauce on how we do our crisis support, and hopefully some of the stuff you can use in your life. So before we do begin, we first want to define what a crisis is, and through the chat it seems like you guys have a pretty good idea of what it is. Like what Raha said, crisis can mean many different things for everyone, and it can be viewed as an umbrella term. A crisis is usually, whatever the caller chatter says is a crisis for them. In some cases, the caller chatter understands where the crisis or distress is coming from, while others, don't really know, or it's not as clear. The task, as a crisis service responder, is to listen for the meaning of what their crisis experience is. For example, the question could be, what does it mean for the caller to have missed an appointment, to be facing an eviction, to have recently lost a loved one? So it could, whether it's like a major life event, accumulation of stress, or if it's like a last straw situation, the experience of being a crisis is something that everyone's like experienced before in their life. The caller or chatter is usually considered the expert of their situation, rather than offering direction on how to solve their issues. We tend to listen non-judgmentally to what they have to say. But if you wanted like a textbook definition, it's typically a situation where, if a person feels overwhelming stress due to something in their life where they're normally, where the normal coping mechanisms aren't working. That's what, a crisis usually is. Coping mechanisms are anything a person does to decrease tension and anxiety in a stressful situation or experience.
Thanks, Gurpreet. So now to continue on the definition of the term crisis, we'd like to note that we support texters with all types of crises. And some issues that texters reach out about are riskier than others. So when we talk about risk, we're referring to the likelihood of a texter or caller being in immediate danger. So in crisis intervention, risk is on a spectrum. So texters and callers who are more likely to be in danger are considered high risk, whereas texters who are less likely to be in danger are considered low risk. So if we ask ourselves, what exactly is danger for a caller or texter? For us, they might be in danger when they're intending to die by suicide, experiencing abuse, and engaging in self-harm. So these scenarios entail high-risk texters and often require, from me, as a mandated reporter, to take actions towards ensuring the texter or caller safety. And oftentimes this means contacting emergency medical services or child protective services as well.
Yeah, and when someone does go through a crisis and when they do call us, what we try to provide is, immediate support that focuses on how to support the person in the short term, the present moment, rather than trying to unpack like longer term kind of concerns that impair their ability to, live a full life, like childhood trauma or like past experiences, that happened like years ago. We try to focus on the present and now. The approach that we take is usually around the person calling or chatting, where we try to empower them in taking a lead in their decision making. And crisis work isn't something that's done to a person, but done with someone. So like a conversation's a two-way street. So collaboration ends up being an important part of crisis work. And with crisis work, like connection's a big part, but we also acknowledge the warning signs that might present in a caller's story, and we try to assess for risk and safety relating to suicide, violence, or neglect or abuse. And to sort of build on that, here at the Crisis Center, we have 6 guiding principles. And these guiding principles help us ground ourselves in our role as crisis service responders. And it reminds us of how we can best support these callers or chatters. So collaboration, the first one, is fairly straightforward, where it takes 2 to tango, right? Collaboration helps us build connection and provide the best possible support. Sometimes collaboration can be difficult, and you just need to accept that sometimes and do the best you can. And that sort of builds on to the next principle, acceptance, where this principle is often used when things aren't going the way you want them to, or you realize when the caller or chatter is not in a better place towards the end of the call. Sometimes the callers or chatters have beliefs that you might necessarily not agree with or align with. You don't need to validate those beliefs, but you also don't need to comment on them. Empowerment is also another big one, where the caller chatter is ultimately the one who controls their faith, and we try to use active listening and reflecting to really get them to think and answer the questions they have for themselves. Short term is also a principle, and I've talked about this, where we aim to be a short-term service and we focus on the short term rather than the long term. Life affirming is, I think, a solid pillar of crisis work, where we ultimately want the caller to choose life and to lead healthy lifestyles. And safety is also a very important one, where safety is what really determines if someone's going to be okay for the night, or if we're going to have to call for an intervention with EMS or police. Safety can also be focused on many different contexts and things, such as abuse, self-harm, and suicide. And it's always something we're looking for and trying to figure out when we do talk to someone.
Awesome. So now I'd like to walk you through what happens in a Kids Help Phone chat through my own lens as a crisis responder. So like you mentioned earlier, crisis work focuses on how to support the person in the short-term present moment. So we as volunteers practice active listening and empathy to help texters move from a hot moment of crisis to a cool calm. So we have 5 principles that drive our approach to crisis intervention. So the first stage is building rapport, which is arguably the most important one. So starting with our first message, we want to establish trust with the texter. This helps to create a safe environment for them to be able to connect with us. And through building rapport, we're able to really learn what led the texter to reach out in the first place. And then stage 2 is the exploration step. So during the second stage, we give them room to open up about their situation, share information, share what they're feeling, and what feelings led to them seeking support. So we're also considering if they're at risk of harming themselves or others, or being harmed by someone else. So we do a risk assessment at stage 2. And then stage 3 is identifying the goal. It's our chance to ask what they hope comes next, given everything that they've been through. We often ask this very overtly to try to be mindful of the texter's time. And texters often experience a loss of control in the midst of their crisis. So as crisis responders, we want to help them return to a more peaceful and stable state, ideally. Stage 4 is discovering next steps. So the purpose of stage 4 is to help the texter continue to manage their emotions after the conversation ends. So for some texters, the next steps might include journaling, making an appointment with their doctor, reaching out to their friends, or getting some rest. Everyone's different, and having a sense of what they'll do when the conversation is over can give texters a sense of control. And we definitely let them lead the conversation to figure out what's best for them. And finally, ending the conversation, we always aim to end the conversation very warmly to allow the texter to exercise the next steps that we brainstorm together. It's a crucial step because it allows us to reflect with the texter on their progress, commend them for reaching out, reiterate their coping skills, and really end on a supportive note.
Yeah, and I guess to sort of build on that, at the crisis line, and what you see in front of you is how we typically go through calls. And you can probably see that, it's quite a bit different than how Kids Help Phone does it. And what you see in front of you is our framework that we use to guide ourselves through a call. So in this framework, you see that calls and chats may not progress in a very clean or sequential way, sort of like when you talk to a person, it's not necessarily boom, 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 right? Rather, the call moves back and forth between components. And the model is what we use as like a reference point to guide us in our calls and chats. So to begin, the thing in the middle, connection, is what the foundation is for all of our calls and chats, and hence why it's the center of our model. Context, it engulfs everything inside, where it's everything regarding the caller's situation and presentation, both emotionally, physically, mentally. It informs us about the level of support we should provide. And then you see that box, exploring risk and assessing the individual. So this is a way for us to identify and share and figure out what the caller's emotions and unmet needs are, to see if there are any patterns in the story, to maybe de-escalate them and hopefully move towards short-term action planning. And that moves to safety planning, action planning, and coping. And they are exactly that, where we try to de-escalate and see how we can get that person towards safety and structure. And if that goes all to plan, we would go on to closure, where we try to end the call, since we are a short-term service, and there are plenty of callers who want to talk to us. And one thing unique to us is the concept of purgatory. And this is something that a lot of us do inherently, but this is a place where you keep all of your assumptions, hope, or beliefs, and thoughts that you might have. It helps us figure out what we need to prioritize, decide, and organize in order to meet the person's needs in crisis. It's a space where you can put certain thoughts aside so you don't divert away from the immediate focus of the intervention, which is the caller. And yeah, and using frameworks like that, the BC Crisis Line Network, has done quite a lot of substantial work here in 2021. So the BC Crisis Line Network, is comprised of 10 local crisis centers around BC that answer calls from 1-800-SUICIDE, 310 Mental Health, and regional distress lines. And collectively, they have around 515 years of experience providing crisis line services in BC communities. So some highlights that we have are that we provided 2.5 million minutes of life-saving and life-changing support to British Columbians. We've safely de-escalated 99.5% of calls without the need of police intervention. A lot of times police intervention can be traumatic and stigmatizing. So, we do try to avoid them when we can. We've supported over 2,200 opioid-related calls, and it seems to be increasing over the years. We've handled over 30,700 calls where suicide was the main reason why the person called us. Other highlights include, we have saved BC taxpayers a lot of money, where we've saved $10 million in hospital and urgent mental health response, and around $50 million in police attendance. And this significantly reduces a lot of stress on police and hospital infrastructure and services, especially with the pandemic and with climate-related emergencies. So yeah, we provide an essential work that saves a lot of money for us as taxpayers. So yeah, at this moment, I'm wondering if you guys have any questions so far. We've talked quite a bit about our frameworks and stuff, so might be a nice time to take a break and pause and get some questions in. And yeah, feel free to unmute, chat.
Hi, can you hear me? I'm Lisa. I work for the National Overdose Response Service. Do you have a specific modality that you follow before dispatching police services, or do you is that a call by call basis? We deal strictly with, we should be dealing strictly with opiate related drug use calls. We deal with a lot of mental health calls. Mm-hmm. But we are certainly very hesitant to send emergency services, because oftentimes we're in a position where our callers are using illegal substances, and dispatching would certainly cause more harm than it would do good. So I wonder if you have a specific modality with your service that you follow, or you just call by call basis?
Yeah, so I guess a way to put it is, it does depend on the context of the call, but it boils down to the question, is this person going to be safe for the night? And if the answer is no, then like our option is to call the police or get EMS to them. If there isn't someone that could reach out to them, then calling the police would be the way to go for us. But that's usually something we try to avoid, as we are aware that it can be traumatizing for a lot of people, and police experiences have been traumatic for the callers that we've had in the past. It's usually like a last resort kind of situation where it's not something that we really want to do. It really boils down to, is this person going to be safe for tonight? Is this person going to kill themselves? Is there anything that's keeping this person alive? And if the answer is no, then police would have to be called. Does that answer your question, Lisa?
Yeah, I think so. Thanks. It's always a very tough call. We actually have a private contract with a company called Northern 911. So if we're dealing with an overdose situation, because we are a national overdose response service, people call us to use drugs. Our dispatch service dispatches strictly ambulance. We've managed to kind of get around having a police presence in that situation. So it's a tough scoot. Everybody in the room that's dealing with our mental health crisis, hats off to you. We'll try and work together.
Yeah, I can imagine it can be really conflicting when you do have to deal with that. But yeah, Jennifer.
We're doing heroin, hard to send the police. Yep. Okay.
Yeah.
Have a good day.
Yep. Jennifer, so your question on how do you manage callers that are intoxicated and are wanting to end their life, that'll be covered later in the presentation. So we will come back to that. Lindsay, is this available for all BC, British Columbians, or is the service area specific? As I understand, there are other crisis lines in BC. Yeah, this is available to all people in BC. Should be, it should be that 1-800-SUICIDE should be available, I think nationwide. And it bounces around different crisis lines in the area. So you'll always have someone to talk to when you are in a crisis. Yeah, if that's it for questions, I think we can move on, Raha.
Sounds great. Okay, so now we're going to be talking about some of our crisis line experiences. Here I've just put in some statistics from Kids Help Phone. So on the left, we see that the text line at Kids Help Phone is the most utilized aspect of the platform, with calls being close second and the online chat not being utilized very much in the past year. On the right-hand side, we see that the issues brought up that are discussed via text are primarily surrounding topics of anxiety, relationships, depression. And we see that substance use or addictions only comprises about 3% of conversations. Here I have highlighted some statistics and kind of milestones that we've accomplished within the past year. So in 2021, there was over 5 million interactions with young people at Kids Help Phone, and this was a dramatic increase compared to 1.9 million in 2019. And we can definitely speculate that the pandemic has a lot to do with this. The crisis text line took over 240,000 conversations within the year. And the bottom right, I highlighted a text or feedback that was found in our latest newsletter. I just want to highlight this because it's one of the more rewarding aspects of the crisis work that we do is when we get texter feedback. So in this message, the texter says that if the Kids Help Phone didn't have a text message option, I don't know what I would have done or if I would have still been here. So this is a tangible way of demonstrating that online solutions and virtual solutions are definitely important and they save lives.
Yeah, and some statistics from Crisis Center BC. We've taken over 43,000 calls and chats over the last year, where that's about a 3.5% increase year over year. Online chats with the youth, did go down substantially. And I think a reason for that is because of COVID-19 restrictions hurting our ability to take calls and chats due to fewer volunteers being able to be present at the center. And with fewer volunteers being present at the center, priorities are put on calls and telephone lines. And from 2019 to 2020, we actually commissioned a survey through Insights West to study crisis service use among British Columbians. And it was found that, like, even in the age of texting, 49% of British Columbians preferred talking on the phone instead of texting or chatting when they were looking for emotional support. Yeah, so moving on from that, in the context of substance use in crisis work, substance use can come up in a lot of different ways. So substance use disorders affect around 6% of Canadians, according to the Canadian Mental Health Association in 2021. Often substance use is concurrent with a lot of different things that might be happening to the person, where substance use is linked to poor mental health and mental illness. You can probably imagine, since substance use can come up in several different ways, it can be the subject of the call. So it could be like an overdose, or them seeking help for it, or them just wanting to talk about their struggles, or things that might have happened to them. It can be part of a suicide plan or self-harm. We've had like many callers who've talked about overdosing on pills, or using their medication to overdose. It can also be a coping strategy for many callers. So if someone's going through a traumatic event, or if something has happened that's causing them a lot of distress, they might get drunk or high to distract themselves. It can also be a protective factor in a way where it sometimes is the only thing that's keeping a person going. It can be a major component of a call. It can just be something that just exists in their lives. It may not even come up in a call at all. Typically, substance use is never the only thing that comes up during a call. So there's sometimes concurrent issues, like concurrent issues socially, physically, mentally, and emotionally that come up. So yeah, substance use isn't like normally the only thing that comes up when we do talk to people when substance use is present in a call.
So when talking to or interacting with people who use substances, it's important to create an environment where they feel empowered and safe to open up about their substance use. So you want to assure them that they won't get in trouble, and that we're going to be supporting them non-judgmentally. So some ways that we can do this is by using people first language. And what this means is to refer to the person before describing their condition or behavior. So when we describe people as addicts or users, it labels them by their illness and dehumanizes them, and can easily lead us to make broad sweeping generalizations about them. So this kind of creates a divide between us and them, ultimately working towards creating barriers in communication and treatment, which is something that we really want to avoid. So to avoid this, we use language that reflects the medical nature of substance use disorders and treatment. So rather than saying abusers, we use terms such as person with a substance use disorder. One should also acknowledge their own beliefs and assumptions. And Gurpreet mentioned the term purgatory before, but it's important to leave the assumptions in purgatory when talking to someone who uses drugs. So substance use may or may not be viewed negatively by the individual, and doesn't necessarily have to exist in a negative context. It's also really important to avoid slang and negative idioms. Also acknowledging that you can't force recovery. It's something that has to be self-driven, and being mindful of trauma. And on that note, it's also important to note that there's intersectionality with substance use and mental health, where it can be a coping strategy for people who have lived experience with trauma, pain, and other things that isolates the individual, ultimately making it harder for them to reach out. So things like racism, trauma, discrimination, these are all disproportionately experienced by marginalized communities, which ultimately leads to a greater risk for substance use for these people.
Yeah, and with what Raha said, with how we typically interact with people who use substances, our roles are to really, provide a safe and comfortable environment for them to talk about their substance use. So like people who use substances do access our services before, during, and after them using substances. And depending on the drug, different needs can also present in the call. And some things that we consider in these calls to help us structure is safety, non-judgment, and structure. Safety is a way for us to collaboratively assess them by asking about the amount they might have taken. You know, like, is it like more or less the same as what they typically take? And this can help us establish or facilitate a conversation about safety. Non-judgment is also an important thing that we consider, where substance use is an area where our helper beliefs can arise. You know, people have, you know, different assumptions and beliefs around substance use, and usually, you know, you want those beliefs to, you know, stand aside and let you focus on the person. And being aware of these beliefs arising and managing them during the call is important when you do provide support for them, for these people. And structure is also quite important here, where sometimes you can get people who are under the influence of a substance, and they can present in a variety of ways. Some may or may not show signs of intoxication. Others might be, you know, slurring their words, drifting in and out of consciousness, telling the story in a non-linear way, becoming easily distracted, or being aggressive. Normally, we would try to, you know, work through it, you know, try to understand what their story is, and, you know, try to work through it. Other times it can be really difficult, and, you know, when someone isn't being uncollaborative, you know, you do need to face the fact and accept that you just might not be able to support them at that moment. Hopefully they can reach out again. And because, you know, the center does get, you know, a lot of callers, and you can only give so much time towards someone who might be under the influence, and if things aren't making sense. But if you're able to establish safety and risk when someone is under the influence, it's, you know, it's great.
So now that we've highlighted some of the positives of the work that we do in crisis work, it's also important to talk about some of the limitations and drawbacks, because they certainly exist. There's a lot of conflicting situations. So in terms of limitations with calls around substance use, crisis line volunteers unfortunately don't have training particularly focused on substance use, and it turns out that they're often ill-equipped in navigating substance use in a call or a chat. So this can make it quite difficult to form connection or trust with a volunteer due to their context and situation. Some callers and texters some individuals might be too scared to call us due to potentially having to deal with police intervention, as we talked about earlier with Lisa. Also, social stigma plays a role, because it can be difficult to vocally open up to a complete stranger, quite frankly, about something that is so heavily stigmatized within society. So these are all some limitations. And now I'd like to talk about boundary setting, which is quite important. So the crisis line, unfortunately, doesn't serve to be a service that can stay on the line while someone uses substances, where a person might fear overdosing, they don't want to be alone. So in this scenario, we would create a boundary by directing them to other services, such as the National Overdose Response Service. Boundaries can also be set if a caller is harassing the volunteer due to being under the influence. This harassment will not be tolerated, really, because it prevents any proactivity from the conversation. So a boundary would be established to create a more safe environment for both the volunteer and the caller or texter.
Yeah, and with the talk about boundaries, and the topic of advice also comes up with boundaries, where we do set boundaries around advice giving as well. This is something that I really want to emphasize, because as volunteers, as crisis line responders, we can't give advice for hopefully obvious reasons, because, you know, a lot of us because we aren't really trained to give advice. Sure, we might have lived experience, but you know, it's not something that we've, you know, been trained to do. There is sometimes confusion around crisis services being a form of counseling for people, And so people would try to seek advice on what to do from us. And this is inherently different from therapy, where therapy is used to manage or resolve usually longer term, longer standing, historical and interconnected concerns. The counselor is usually specifically trained to provide that kind of support and guide their clients toward longer term goals. We at the Crisis Center don't do that. And I think many other crisis lines also don't provide counseling in that sense. So when people are in a crisis state, their minds and bodies usually go into a reaction mode. That mode would be fight, flight, or freeze, where each option requires a lot of energy as your body gets ready to stop thinking and start reacting. And that sort of brings on to an important point where acting without thinking can get us into a lot of trouble. So calling someone to talk you down off a ledge is a smart, proactive thing to do. Talking to someone who will just listen is how you turn your reaction back into thought. Crisis, so I guess like a really nice way of putting it is, crisis response is about getting you back into your thinking mind. Counseling is what is most helpful when you are ready to think. So think of it like crisis, like when you're in a crisis, you would call the crisis center, the crisis line, and once you're in a stage of thinking, you can then, look for counseling. Ooh, is it lagging? Oh, never mind. And moving on from that, there are also a few drawbacks with online chats here at the crisis line. So a thing that you might not be aware of is the crisis line does have a priority ranking in terms of the call and chat lines we have, where online chats are of lower priority compared to 1-800-SUICIDE and 310 mental health. So, if there is a scenario where there are a few volunteers or staff present, so let's say less than 3, they would normally focus their efforts towards the telephone lines, leaving those who might want to do an online chat waiting for extended amounts of time if there is no volunteer free to do one. Online chats also introduce a lot of ambiguity in terms of us being able to send intervention help to the person in crisis. So let's say if we weren't able to establish if someone was safe for the night and it seemed like they might kill themselves, if they had like a VPN, or if we only have their IP address, it can make sending intervention really difficult, sometimes impossible, where we only really have the information that they give us when we do talk to them. Wait times can also be pretty long depending on the time they're texting in, And another big challenge is that, if crisis responders are active and busy with callers who are unresponsive, so let's say you were talking to them and they walked away from the chat, it can add on to wait times for other chatters that are looking for chat to chat. Yeah, and that moves on to our next point about online potentials for intervention and care. And Raha can talk about that.
Yeah, so in line with the theme of the conference, we want to talk about why online can be a really positive thing for users with high risk of self-harm and suicide. So while crisis lines can provide immediate access to barrier-free, non-judgmental, confidential support 24/7, many may not want to call in and talk in person. Some find comfort in not having to talk or having true anonymity. They might fear the stigma of seeking help and have anxiety about voicing their problems out loud, or are afraid that someone they know could be listening in. So that means they might not have a private space where they feel safe and comfortable to voice their pain. And having access to crisis services online makes it more approachable, less daunting compared to someone. So sometimes people just don't have the energy to talk. And also with online platforms, accessibility increases. The crisis text line at Kid Cell Phone can be accessed without a cellular plan or a phone. It can also make it easier for more people to volunteer with the organizations, because some office spaces are not able to accommodate those who might have physical limitations, inhibiting them from volunteering. Also things like a global pandemic where social distancing is in order, are a factor here. And online interventions also reduces possible barriers that are posed by the nature of calling someone. So if you're a person with physical or verbal limitations, texting or typing might be your only way of communicating. And an anecdotal plus to working as a crisis responder online is that I have time to digest what people are saying to me, and I have time to process. So I can think about what I'm going to say for quite a while, a few moments before I choose to respond. I can also look up resources, reach out to my fellow crisis responders, reach out to my supervisor, and then I can make an informed response. Whereas volunteers on the crisis lines have to respond more immediately due to the nature of having a verbal conversation with someone on the phone. So to kind of close out our presentation, we want to talk about current online and remote solutions for substance use. So here's a list of a few that we found. So the first one is the Lifeguard app. It's best known for the use alone timer that will send emergency services to a user's location if they become unresponsive after consuming substances. This app is also incredible. It offers several resources such as an naloxone guide, a CPR guide, services near me, direct 911, 811 calling, and a crisis line. Then there's the Brave app, which is similar, but also very different because it connects people who use drugs within a community of members who can detect and respond to overdose. So it's anonymous, private, user-led, and the Brave app delivers harm reduction and community support on the user's terms. So users set up an overdose plan that puts them in control, detailing how, when, and who is sent for them if they need help, and supporters activate the plan if an overdose is detected. Then there's the Risk Assessment Management Platform, which is a platform designed by Dr. Michael Kraus and the team here at Addiction ACD that focuses on the integration of different forms of risk assessment and support in an interactive way. So RAMP can be used by people who use substances and manage the risk of overdose through educational modules, evidence-informed resources, and goal-setting opportunities. And then there's FAR Canada, which acts as a voice for families for addiction recovery. This is a resource that's very rich with a plethora of other educational resources, such as books, online support groups, educational mental health websites. It really aggregates a ton of different valuable resources for families who might need it. And then North, we have someone in the audience who works here, is an overdose prevention hotline for Canadians, providing loving, non-judgmental, confidential support for you whenever or wherever you use drugs. So, and then there's Foundry BC, which Gurpreet will talk about.
Yeah, Foundry BC. And I wanted to highlight this one because it's relatively new in BC, where it's honestly like a go-to resource when we do talk to youth at the crisis line. So whenever youth do talk to us on 1-800-SUICIDE or 310 mental health, Foundry BC is our go-to resource. So Foundry BC is like a mental health service. It's like a how do I say it? Like an aggregation of mental health services that's available virtually and in person, where they have centers around the Lower Mainland. And it can provide drop-in counseling, virtual support, virtual peer support, and a variety of other things. It's sort of like the end-all be-all for mental health support, or like a great way for youth to get in touch with mental health services. So yeah, if you have a youth in your life, or a kid in your life who is struggling with mental health, Foundry BC is a great way to get them support. And that sort of leads on to future possibilities. There's been a big push for virtual mental health services, especially now with the COVID-19 pandemic. So hopefully with this big push for virtual mental health services, infrastructure can be improved, where I know a lot of the software and tools that we use here at the crisis line is fairly old and limited in terms of our options. And overdose and substance use training in crisis services could also be introduced, where with the growing overdose crisis, it might be helpful to have specialized training around overdose and substance use, where there aren't a whole lot of places where people can debrief overdoses or express their feelings and experiences with an overdose. And video conferencing could also be made available in crisis services, maybe as like a limited option, where it can add a human aspect to the service since it's always nice to see a face when you do talk to someone. Like, with Zoom, like in a lecture, it's always nice to have, faces to people instead of just titles. And another thing that came up actually right before the workshop was, I think it was Elizabeth who brought it up, was the lack of a centralized hub for a bunch of virtual mental health services. This doesn't exist right now here in Canada, but it does exist in New Zealand. And if you want to write it down, it's called the New Zealand Telehealth Service. And it's basically one number, and you call that number, and it transfers you to the appropriate service based on what you want. So an example, so it's sort of like, let's say you call 911 and it says police, fire, ambulance. It would direct, and you would say the option, and then it would direct you to the service itself. So we don't have that in Canada, but hopefully a centralized hub for resources can be made in the future.
And with that, we will share our final remarks for our workshop.
Yeah.
Here they are. They're on this slide. We want to thank you guys so much for listening. It's been a pleasure chatting with you all. At this time, we have a few minutes left in our workshop. If anyone has any questions or comments or experiences they'd like to share, we'd love to hear it.
Yeah, and I don't mind staying back if there are questions.
Yeah.
Yeah, so yeah, if you guys have questions, use the Hua chat, use the Zoom chat. You can also unmute yourself, and yeah, we can have a conversation. Okay, I'm gonna stop sharing. Yeah, any questions or comments? Anything on Hoover, Raha?